I got into radiation therapy to become a radiation therapist, which I did and which I enjoyed. At that point, I did that for a few years, and then I became a simulator therapist, and it sort of evolved into becoming a dosimetrist. So I'm pretty content with what I'm doing. It's a great job in that you kind of work by yourself on a plan. You have, your window of days that it needs to be completed in. You have to be very, I think, conscientious, multitasker, and strong communication skills. So our department is very cohesive. A lot of people are involved in the patient's treatment plan in various ways, but we all work together to ensure that the accuracy of that treatment plan is acceptable and achievable. So it's a great field. So if you're interested in a medical field, my advice would be to shadow or visit departments and spend, a half a day to see what they do. Obviously research, the field, but ask people, what is it about this job that you like, and what kind of skills would you feel that are necessary to do this job? I know for us, multitasking is so critical, and working very closely with people under somewhat stressful, situations is critical. So you have to, see people doing this and then ask people a lot about what it is they like. So I think most major hospitals have radiation therapy. You can easily contact the hospital departments and see if that's a possibility for you to shadow. And for our radiation therapy students, because we have a radiation therapy program at OHSU, it's 40 hours of observation that they're required to complete as part of the application process.
So when I look at the medical field, obviously look back in even the early 50s or so, right? There was very little technology used. Now you look at medicine nowadays, there's so much technology everywhere. And I think radiation therapy in particular is of interest because I would say the way we treat patients in radiation therapy is really driven by technology. And the fascinating thing is at the end of the day, I'm calculating dose inside a patient based on a CT image that I take of this patient. And I, as a medical physicist, can help to develop technologies that allow us to come up with more conformal techniques to treat the tumor, which allows us to go to higher doses to the tumor without causing side effects, or we can limit side effects. So it's a very applied use of physics. My degree is in physics, but I'm working in the medical field. So I work with physicians, I work with nurses, I work with sometimes radiobiologists, and we interact with medical oncologists and surgeons and neurosurgeons when we treat pain, cancer. And so I think it's really fascinating how we use the physics to help patients being treated who have cancer.
Medicine has always been something that I think I've been interested in. I would say for me since early in high school, and some of the people I was subjected to as a young child, some of the role models were physicians, and I was at an early age felt that there may be opportunities to really help people and be in an area that was very, very exciting. So usually surgery and pathology were the areas that were most exciting to me. I eventually went into internal medicine, which is a more broader aspect of medicine, and enjoyed that. And then also subspecialized once I decided I wanted to be in the cancer field to help cancer patients. So I took specialized training into medical oncology, which is a subspecialty of internal medicine, and then practiced as a medical oncology for a couple of years at a major academic medical center, the University of Washington in Seattle. It was during that time we actually shared a clinic area with the radiation oncologist. And I was concerned earlier in my life, in my career, that radiation oncologists might be nerds or physics, math nerds. They didn't see any patients, and they were in the basement, and they only dealt with numbers, physics and things of that sort. That's not true. They work with a team of members who helps them. They actually see patients, There actually is a science behind the delivery of radiation that we tried to elucidate with part of our discussion today. And I felt with my training as a medical oncologist, where I was trained to give chemotherapy and systemic therapeutics, by adding training in radiation oncology to understand the delivery of therapeutic radiology, that I might be able to help more patients. And so I decided to get further training to become a radiation oncologist. But again, radiation oncology is not something you'd be subjected to, radiation oncology is not an area that many students think of when they apply and eventually get into medical school. But we think it's very, very exciting. It's one of the smaller branches of medicine, but it's one of the most exciting. And we use a lot of emerging, rapidly evolving technology, and we work with a team, and we help patients. I think working on a smaller research project, so you can see some of the applied aspects of the pre-med courses and the reason, why one has to learn certain fundamentals of chemistry, physics, and biology. I think such a research project can actually give some satisfaction in clinical applications. Exciting aspects to come to work to, number one, treat patients, and then here at OHSU, the whole area of discovery, to find new ways to do what we do better, more efficient, and really be able to synergize the areas of different aspects of medicine together. We're not in a silo, and so probably the thing I'm most excited about is interacting with people across disciplines, and I think that's exciting.